mean, number one, the support system. We are actively licensed medical doctors. So we were raised up in the conventional system, the Western way, and our hands are tied, behind our back when it comes to thinking outside of the box, considering alternative solutions for patients. Even today in cannabis, we know there are tens of thousands of peer-reviewed articles on the science and pharmacology and physiology of the endocannabinoid system in cannabis. Yet people are still saying there's not enough research, there's not enough data. And therefore, there is some ammunition probably that people could use to come, after clinicians like us. And there are many of us. I mean, we're growing in numbers every day. So I think it's been great to have some insulation as a family in entering into this space, because it takes some guts, it takes some risk to be different, and especially when we're beholden to medical authorities that govern our licenses, we have to be careful. So I, for one, I felt probably much more comfortable than I otherwise would have, having my parents lead the way, and then having my sister that, we were educated together. So we've been together this whole time. And so I'm glad this has kept us connected.
It's funny because sometimes when I tell people what I do, they're like, oh my God, what do your parents think? I'm like, they're the ringleaders, they started it. So it is fun.
So Jess and I went into medical school together. We applied to Tufts and other dual degree programs because our mom recommended that we do something different with medicine. And so for us, we were like, okay, that means get an MBA. So we only applied to dual degree programs in both medicine and business, wound up at Tufts together, and recognized through our business classes that, whoa, doctors aren't taught the business of their own profession. That's a big problem. And as I learned more about the business of Western medicine, I understood that what we're being trained into is really a chronic care system. It's not a healthcare system. I wanted to be a doctor to help people heal. I wasn't learning how to help people heal. We didn't learn about nutrition in any meaningful way. We didn't learn about exercise in any meaningful way. We certainly don't learn about botanical applications. And so in the middle of my medical schooling, I recognized that there was a major disconnect, and I already started to look for other things. And I ended up going into a family medicine residency program that already integrated integrative medicine. I wanted to learn about herbal medicine. I wanted to learn about ancient Chinese medicine to some degree. So when my mom started talking about cannabis, my curiosity was super piqued, and I asked my attendings in North Carolina what they thought about it. And I got the same old responses. There's not enough research. Nope, marijuana is a drug of abuse. And that's it. And I already knew better, so I just let it be, but was really excited to leave residency when I completed it to come back home and get into cannabis with my family.
I was surprised because, as Rachel alluded to, we only learned about cannabis as a drug of abuse, as a gateway drug. There was nothing positive that we learned about cannabis in medical school. And I think our mom started working in cannabis medicine clinics when we were in residency. And so I was in residency in Southern California, and then, of course, people know about Venice Beach and the notorious pot docs and the bad actors in the system. So I was kind of like, oh my gosh, what is mom doing in her retirement from anesthesia? Like, she's lost her way. But she was sharing with us the research she was reading about cannabis as medicine and about the endocannabinoid system. And for me, more importantly, sharing the stories of patients she was encountering and the benefits they were getting and the quality of life improvements they were experiencing. And for me, those experiences were things that I was not experiencing with my own patients in a primary medicine clinic. And as Rachel said, I went into medicine to help heal. That's not what I was doing. And so hearing that in this other space that had always been demonized, my mom was having these experiences of patients finding success and finding health again and being restored to a quality of life that was meaningful. I finally got the realization, hey, there's something there.